I'm so glad you're here. This is episode number 1, and I want to share the framework of this podcast, what to expect, and most importantly, why this space exists. This podcast is about weight regulation, metabolism, hormones, and the everyday habits that quietly but powerfully shape our health. We will talk about nutrition, movement, sleep, stress, and behavior. We will also talk about how to break unhealthy patterns that no longer serve us. The patterns that often develop not from the lack of discipline, but from survival, conditioning, and biology. My intention for this podcast is to be a trusted space where evidence-based medicine meets real life, a space where complex medical science is translated into clear, relatable conversations, and where you can walk away with tangible, practical tools that you can actually use. My hope is simple but profound. That every listener feels empowered to take control of their health with clarity, compassion, and confidence. We will talk about improving your relationship with food, navigating common challenges, developing healthy coping skills, and learning how to care for yourself while life keeps lifing and adult responsibilities pile up. Every time you choose a healthy habit, no matter how small, you're investing in yourself. Let me share a little bit about my journey to this work. As a young girl, my journey into medicine was rooted in a desire to combine the analytical rigor of science with the human connection that truly changes lives. I was always interested in why. Medicine is complex, challenging, and constantly evolving. And early on, I realized something important. While many of my friends and peers were fascinated by complex disease processes, intensive care medicine, and the adrenaline rush that you get from saving a critically ill patient, I kept thinking about something else. I kept asking this question: how do we prevent people from ever getting here in the first place? How do I keep these patients out of the hospital? I practiced primary care for over a decade. I loved it. I loved the relationships, the continuity, and the trust my patients placed in me. But I often felt very limited by time. I was unable to truly change the long-term trajectory of anyone's health. That's when it became clear to me that treating illness alone was not enough. I wanted to understand prevention. I wanted to reverse chronic diseases. And as I looked across nearly every chronic condition like diabetes, heart disease, high blood pressure, fatty liver, I saw a common thread: weight. That realization led me to pursue certification in obesity medicine and lifestyle medicine. Today, my practice focuses entirely on weight management, hormones, and chronic disease reversal. And in this podcast, I will share how I practice, what I've learned, the science behind it, and real-life experiences from caring for patients every single day. Now, how do we define health? Before we go any further, we need to answer this fundamental question: what is it that we are trying to do? What is health? Why does it matter? To me, good health is a dynamic state of physical, mental, emotional, and social well-being. It is not simply the absence of disease, but the presence of resilience, balance, and capacity. It's a perfect symphony of your metabolic health, cardiovascular fitness, muscle strength, mobility, sleep, and low burden of preventable diseases. The foundation of it all is rooted in mental health: cognitive clarity, emotional regulation, psychological safety, and ability to cope with everyday stresses and adversity. My role as both a physician and a life coach is to help you achieve sustainable health through intentional alignment across all of these domains. Why does it matter? Because it's not just about living longer, it's about living well. It's about health span and not just lifespan. The years that we live with energy, with clarity, with vitality. And we also know that health is never static. It changes every single day, every single moment. It evolves, shifts, and requires recalibration again and again over time. Before we delve into obesity and weight, I want to talk a little bit about stigma. I want to be very clear about something very early on, that it is not a moral failure. A significant part of my advocacy work around obesity centers on addressing this immense stigma and the deep psychological harm it causes. Most of my patients already know that their weight matters. They know that eating well matters. They know exercise matters. And many of them eat well, move regularly, manage their stress, and prioritize sleep. Yet they struggle. So the real questions always become, what does healthy weight mean? Why do some people struggle with weight while others don't? Why weight loss is difficult to sustain? Why weight regain happens even after doing everything right? And most importantly, what can we realistically do about it? Why does what weight fluctuate across a lifetime? And why does weight regain even happen after bariatric surgery? You'll get answers to all these questions in this podcast. You will also understand weight as a biological condition. You will understand that obesity is a chronic neurohormonal disease rooted in genetics and biology, which is significantly influenced by environment and lifestyle. Unlike diabetes or hypertension, the visibility of obesity brings shame, bias, and judgment. It is never just a number on scale. The weight discussion gets deeply rooted, intertwined with emotions, lived experiences, trauma, and personal history. For decades, it was framed as a problem of willpower, with the simplistic advice of eat less, move more. Many patients have been dismissed, even within healthcare, and were blamed for their weight, often without empathy or curiosity. That kind of experience is deeply traumatic, and yet, despite how freely weight loss is recommended, meaningful tools and evidence based care is not offered. I've thought also about the cultural portrayals of weight loss, including The Biggest Loser show and also the documentary that came later on, and how that show exposed a very profound misunderstanding of this disease. We will talk more about this in the future episode. Coming back to this podcast and my goal as a physician and advocate, it is to create a safe, compassionate, evidence-based space where weight can be discussed without shame, where we shift the focus from what it looks like to what causes it. Recognizing obesity as a chronic disease is not just a medical classification. It is a necessary step towards reducing stigma, normalizing care, and helping more people access the treatment they deserve. This field is evolving very rapidly. We are seeing advances in medical therapy, surgical approaches, and just as importantly, a cultural shift also. There is a cultural shift that we are seeing towards body diversity and inclusivity. Movements like body positivity and initiatives that celebrate diverse body types allow us to hold two truths at once, honoring the bodies as they are, while still addressing the implications on health with compassion and science. The single most important I want to leave today is your weight is not your fault. It is not a choice. It is not a failure of willpower. And in the next episode, we'll dive deeper into my personal why and why I'm doing this work. Thank you for listening.